I'm delighted that this has been chosen as a topic.
As President J.A. Perman launched the third year of the President's Symposium and White Paper Project, the new fellows were front and center as they were given their new charge. The topic, interprofessional education, in keeping with one of the university's core values, collaboration.
In a place like this, we ought to be ahead of the curve. We ought to be teaching people to work in teams while they are learners, while they are students, while they are in training, and I think even beyond that, for those of us who are my generation and who weren't educated and trained this way, we have a responsibility in continuing education to prepare the community. You have to look at all of this. You have to decide, number one, what is missing in terms of scholarship around the value of interprofessional healthcare. And you have to, if you decide that interprofessional education to prepare people to work in teams is worthwhile, then you have to help us to move our thinking, move the culture here, move the curricula here to the point that we do it properly.
Fellow Kimberly Solovey introduced UMB's Director of Interprofessional Education. School of Nursing Dean Jane M. Kirschling brings a background in IPE to her dual role.
We have to foster interprofessional collaboration, and that's where the work comes in terms of the IPE Center and the work of the scholars, and the work that happens every day across the street at UMMC, and that's happening in our schools, in terms of really wrapping our heads around how do we break down the silos that exist amongst the disciplines and break those down, not to replace our professional identity, but to really allow us to blossom and to bloom in terms of collaborative work across the disciplines.
Fellows and faculty alike took part in a Q&A session after the presentation.
I heard a lot of things, though, in the bucket, and it's not really clear to me as a faculty what our real goal or focus, because there's a big difference between interdisciplinary education versus interdisciplinary practice. The other thing that I would be curious about the school addressing is the whole financial piece. The ACA, the focus is, in fact, cost-effective, high-quality care. And I didn't hear a lot of discussion around that. That's been, as somebody in geriatrics, that's been our biggest challenge. We all know teams are great. They're very expensive, unless we take it from a perspective of who can provide the care at the most appropriate cost. So I'd just be curious where we are as a school.
You've been in geriatric care for a really, really long time and made a huge impact. Barbara Resnick, I had the good chance to go over and to see where she practices, and quite amazing in terms of the care that's provided. It's going to take some really creative conversations in terms of prioritization and in terms of listening to the people that come into our contact about what do they want and what do they need. And it also then requires that we create a generation of health professionals who actually understand and value one another, and that we don't wait till they get to the practice setting to retrain them. And that's, I think, one of the struggles with it, because that's where, when you're going through your discipline formation, if that's so locked in, then the ability to chip away at that and to value others becomes really, really hard to do. So it's not going to be easy, but we've got to go about the business of doing this work. And not everybody will get team-based care, but where it's most needed, we're going to have to figure out a way to provide it. Otherwise, we're going to drive more expense and not get the cost containment.
Some of the fellows talked of what they bring, including a law student inspired by the president's IPE clinic.
One of the things we don't want to do, but we end up doing, is you get sort of comfortable in your zone. You know, here I'm a law student, I know all the laws, I know the legal issues, but when you step out of that and you think about that individual and you see, okay, here's someone from the School of Pharmacy thinking about it from their perspective, here's someone from, the School of Social Work thinking about it from this perspective, and it was really exciting so that we can all come together and holistically not just say, okay, this person has this disease and we'll treat it, but we had an opportunity to maybe do some additional research, identify programs that could help them, beyond just the visit. And so that was really exciting, that collaborative event. And it's along what I'm interested in doing in terms of being able to, work with the individual beyond just here's your disease, here's a pill, go home. We want you to be healthy all around. And to the extent that we can use the law to help address some of those social issues, I think that's right.
I've noticed in the past, in hospital settings, I've had a lot of interaction with people in different disciplines and noticed that there's such a disconnect in those disciplines. So I'd like to be able to try to make that connection, from the student level, from the educational perspective, and push that forward.
I don't come from a social work background, so I'm coming from something totally different, and just trying to integrate with different professions. I think it's so important that that I have the skills in order to understand where different people are coming from, and I think that this is a great way to get that point across.
Personally, having worked in a hospital, it became very clear when I set foot in the wards that the doctor, which traditionally people thought, the doctor calls all the shots, that's just not the way it works anymore. Everyone works together on a team. And it became very clear to me that there were some folks who were really good at working on a team and some folks who were not. And so I became very interested in this during my time in medical school and then continued in my intern year, because I found that I was working more closely with a lot of the nursing and pharmacy and social work folks than I had originally anticipated. And I really enjoyed it. So I wanted to study it further and see how I could maybe take the next step and work to integrate it better at UMB here with the fellowship.